So, proactive team, I wanted to just go on and share some tips for you to do at home for if you are running a little bit more, if you're starting to get some sore feet, some sore calves, lower leg, basically anything below the knee we're going to talk about today. And I've done this video before and it takes too long, so I'm going to do it a little bit quicker today. We're talking about plantar fasciitis, Achilles tendinitis, calf strains, shin splints, those type of things. So if you've been running a bit more, walking a bit more, or just feeling like different footwear, anything that's giving you some issues there, we're going to go over some things that you can do at home. Okay, so we're going to start with the feet, and for the bottom of the foot, the plantar fascia area under the arch is going to be some rolling. So that's the best way to get in there. You're going to take your therapy balls, that's what I'm using, the therapy balls that we'd use in the stretch class. If you don't have one, a tennis ball, one of those red hockey balls that kids have for outside, even a golf ball would do the trick. So you're going to put it on the ground. Let's see where we can see this here. And you're going to put your foot right up on top. The arch is going to go right on top of the ball, and you're going to roll back and forth. You're going to go side to side. You're maybe going to put your heel on the ground so the foot's on the ball, and you're going to go back and forth sideways. Or maybe your toe on the ground and you're going to go back and forth with the heel. Now, we just don't want to ever be rolling the bottom of the heel bone itself because there's not really a point of that. You're just going to irritate it more. So you would do some rolling, both feet. I would do 1 to 2 minutes per side, and I have some patients who will do this while they're watching some TV, maybe just sitting and doing it. They might do it first thing in the morning. If you have plantar fasciitis where it's so sore and it's hard to get out of bed those first few steps, have the ball beside your bed, your tennis ball or whatever, and then just roll for 30 seconds to a minute before you stand up. It'll make a huge difference. So that's the first one, is you're going to be rolling the bottom of your feet. Next thing that we need to address is the calves and the shin muscles. So for this, I'm going to show you a couple different options. First one is with the foam roller that we've used before. Let's see if you can see this. Yeah. So we've got one here. And you're going to put your legs up on top. You're going to rock. First, just rock your feet back and forth. So you're giving them a bit of a sideways massage. Push forward, rock back and forth again. And then maybe one more time so you're really at the top of the calves and you're rolling back and forth. So this gives you an idea of where the sore spots are going to be. And then you can come back to roll with the foam roller. You're going to have to put your hands flat on the ground, lift your body up, and you're going to push with your arms. So you're rolling yourself along. You're going to feel some sore spots, and if that's the case, take some more time there. I like to sometimes, see if we can see it, turn the feet out so the toes go away from each other, and then you're going to roll. So that's the outside of the calves. Some people have more issues there. And then you can also turn your toes in towards each other and then roll closer to the middle or center of the calves, and you're going to feel that there. So for rolling, 2-3 minutes is plenty, and you're going to spend time on different areas depending on what's the most sore. Now, option 2 for the calves is going to be using a handheld roller like we have here. If you don't have one at home, because not everybody does, runners often have, it's called a tiger tail, something like this, but a rolling pin from your kitchen is going to do the trick, and in fact, I use mine here at home. It's just a wooden rolling pin, and it does a really good job. So if you don't mind, if you're not in the middle of baking a pie or anything, then go ahead and get that out. And this way, you can roll without having to get on the ground, without really having to do too much. So you're going to roll the front of the shin. Just feel along the front for where the bone sticks out. We want to be avoiding that. So first one, shin splints on the outside, tibialis anterior. You're going to put your roller not directly on the bone. You're going to go to the outside of the leg and roll along there. Just like you're rolling out some dough. And there'll be some areas that are tighter, and you'll go more in there. Spend a little bit of time. Again, maybe 1 or 2 minutes along this muscle. And you can use as much or as little pressure as you want. And then, of course, sometimes we have shin splints that run along the inside of the shin bone. So right where the muscle meets the bone here, if you follow your fingers along, that's your tibialis posterior. That's a more common one for some of our runners, some of our patients. So if that's the case, you're going to take the roller underneath and you're going to roll along the back of your calves. Keep the leg fairly relaxed. If it's up tightly and the muscles are tight, you're only going to be getting the superficial muscles. You're not going to be getting to the deepest layer, which is where your tibialis posterior is sitting. So nice and relaxed calf. Roll along the back. Roll closer to the bone, but not on the bone. And then roll to the outside. And again, you'll spend a minute or two doing your calves. Okay, and you'll do both sides. So last thing that we're going to do with calf and leg issues is stretching on the stairs. And I'm going to show you here. I have just a little step, kitchen step or whatever, but I probably would recommend, and I usually recommend to patients at home, is their stairs, because you have a banister, something to hold on to, and just go on the lowest stair, hang on to the banister, and then you're good to go. So you'll step both feet on the stair. Let's say it's your lowest stairs. Hang on to the banister. You're going to move one toe to the edge of the stair, so about half of your foot is on, the front half, the back half of your foot is hanging off, and then you're going to lean your weight down so that your heel drops towards the ground. Notice this leg, the one that's stretching, is straight, and you're going to hold that for 30 seconds. And once you've done 30 seconds there, you're going to bend the knee forward, still keeping the weight on that leg, but now you should feel the stretch move from the upper part of the calf down towards the lower part of the calf, towards your